African countries have stepped up proactive measures and enhanced their capacity to test for the COVID-19 virus. In the last week, 10 countries have announced that they have fully equipped laboratories able to test samples of the virus. Previously, only 2 countries, Senegal and South Africa, had the capability. They served all countries in the region. The World Health Organization says it hopes that by the end of February, 36 countries on the continent will have testing equipment. It has dispatched experts to Africa to assist in surveillance and early detection. Now, early this morning, I spoke to Kenya's national broadcaster on their program, Good Morning Kenya. I spoke on China's efforts in controlling the outbreak. I also disputed claims of disregard of African students in China, stating the case of a student from Cameroon who contracted the virus in Jingshu City. That student was treated and all his medical bills paid by the Chinese government. During the interview, I urged the media to avoid circulating unverified information. Meanwhile, African governments have expressed support and confidence in China containing the virus. They've said African students in China will not be evacuated since China has the capability to handle the virus. We can tell our audiences exactly what it is, how to protect yourself, what authorities are doing to protect the population and so forth, right? But we also need to understand that we don't need to sensationalize. We don't need to do scaremongering is the word that I'm talking about. We need to rely on facts. We need to rely on research. We need to rely on scientific data. We need to rely on what the World Health Organization is telling us. We need to rely on what health authorities are telling us. Because let's take an example of the AIDS crisis in the 70s and 80s, right? When we stigmatized the people, they went underground. It is not going to affect China's domestic growth as well. And even us in Africa, we have been talking to business people. I spoke to the World Health Organization. We now have, as of this week, we have a laboratory in Ghana, Madagascar, Nigeria, Sierra Leone, and Ethiopia. They've also announced that they are able now to conduct the test. WHO is also sending kits to 29 laboratories on the continent to ensure they have the capacity. China is also has released some $80 million to fund a Center for Disease Control in Ethiopia to enable us to have that capacity. So when you look at, when you talk about the contacts, the people-to-people contact, anybody who comes in from China, right, already goes through thorough testing at their port of exit. At our port of entry, we already have the temperature scans in all airports across the continent, right? Because we were already testing for Ebola. So that was already in place. Now we have this added capacity that has been given to us by WHO and by the Chinese authorities. So when you look at it, really, there shouldn't be much worry that we don't really have the capacity 100%. Now, even when you talk about Kenya, right? Yeah. The health ministry had indicated that they had already set up a quarantine facility in the event that anybody, was thought to have the coronavirus. In other countries as well, that has been set up. So on the continent, the capacity is building up. Even though we had concerns about the health status of weaker states, the capacity is now building up to ensure that, that we are able to deal with this. Just to point out that, yes, we have about 1.5 million Chinese tourists that visit Africa annually. We also have about 10,000 Chinese enterprises, right, that operate in the African continent. When you talk about 10,000 Chinese enterprises, they're not all shutting down. Yeah. So it is business as usual on the continent when it comes to doing business with China. The Chinese government gives 50,000 scholarships to African students annually. That number has been progressively rising during every other 3 years, right? So there are thousands of African students that are in China. I'll give you the example of one Cameroonian student, the first student, yes, that was infected with coronavirus.
Right now he's doing well.
The student was treated in China. He took himself to hospital. He was treated. He has been cured, and he is, continuing with his business in China. So in terms of, are there concerns that the African students or the African business people that are in China, that they may not be looked after? There is no validity to that concern at all, based on the situation of that one Cameroonian student, right? He went to hospital, he was treated, he recovered, he went on with his life.
So if it's possible for him, it can also be possible for many more people.
Well, it is possible for everybody. The Chinese authorities are taking very keen measures to ensure that every single person is taken care of. If you feel that you have the coronavirus, or if you're detected to have the coronavirus, every single person, regardless of race, is being taken care of. And that is why they're releasing also the figures of the foreigners who have contracted the disease. So they are capable of taking care of everybody.